During the next few minutes, we'll be taking a look at how you might interact with your healthcare provider the next time you get an injection. The Safe Injection Practices Coalition strongly encourages patients to ask questions to make sure that their providers understand and follow safe injection practices to reduce the risk of transmission of hepatitis B and C, HIV, and other infectious diseases. That means always using one needle, one syringe, only one time. Over the past few years, tens of thousands of patients have been potentially exposed to infectious diseases because syringes were reused. Hundreds contracted hepatitis B and C viruses and other types of infections. Don't let it happen to you. Here's the way we wish all patient-provider discussions would go.
Mary, you look terrific. I understand you're getting ready to travel.
Sure am. So I'll need a couple of shots. Did you hear about that hepatitis outbreak? I forget in what state, because a doctor, maybe a nurse, reused syringes. I couldn't believe it.
It is unbelievable, and it should never happen. Let me tell you a little bit about the precautions that we use here.
Okay.
This time, it was easy for Mary to discuss safe injections with her healthcare provider, but in some cases, it can be hard to ask these kinds of questions. And you may be worried about how your provider will respond. Will he or she be insulted by your questions or be too busy to really address your concerns? Most healthcare providers will be happy to answer your questions. But for those rare other instances, here's how you might handle the situation if your provider dismisses your concerns.
Now, you know I like to keep up on the latest in medicine. And there's something I heard on the radio that concerns me. I'm worried that I could get hepatitis from an unsafe injection. It's happened all over the country.
Listen, I've been doing this for 30 years. I think I've got it covered.
Well, actually, it's because I trust you that I'm asking. And this is very important to me. It's not just me asking. It's respected organizations like the Centers for Disease Control and Prevention and the Safe Injection Practices Coalition that are encouraging patients to ask about safe injections for their own health and peace of mind.
Okay.
Remember, you have a right to ask about safe injections, even if the office is really busy the day of your appointment.
So to treat your anemia, I would like to start you on injections of B12.
You know, I've heard about hepatitis and other diseases being spread when getting a shot. I'd like to know how this happens. This kind of concerns me. Can we talk about this?
I wish I had time, but we're really booked solid today and I need to get to my next patient. So why don't you just let me take care of worrying about that?
You know, I understand about time crunches and everything, but I really would like to take a couple minutes to talk about it, as I recently heard about this information on the news and on the one and only website, and I would really like to take a couple minutes to talk about it because I really trust your expertise on it.
As you've seen, you can ask these important questions in a way that shows your healthcare provider that you do trust him or her, and that you're not asking because you doubt their expertise. But what happens if they feel insulted? Well, you can handle that situation too.
Okay, Tony, looks like, looking through your chart, it looks like I can give you something that can make you feel better right now.
I've heard that you can get an infection, like hepatitis, if a syringe is reused. Should I be worried about that?
When did you get your medical degree? No, you can't believe everything you read on the internet.
I'm asking you because you are the expert, and you're the best source that I have. It's not just me asking. It's respected organizations like the Centers for Disease Control and Prevention and the Safe Injection Practices Coalition that are encouraging patients to ask about this for their own health and peace of mind.
One other way to ask these questions is to reference an outbreak that happened somewhere else. You're not challenging your own provider's skills and knowledge. You'd just like his or her professional opinion. Remember how Mary did it?
Did you hear about that hepatitis outbreak? I forget in what state, because a doctor, maybe a nurse, reused syringes. I couldn't believe it.
Remember, the vast majority of healthcare providers give safe injections, and you should never refuse medical treatment that you need. Responsible providers will understand why you want to know about safe injections, so don't be afraid to ask. Find out more at oneandonlycampaign.org.